Here at home, flu cases are rising at an alarming rate. Nationwide, hospitalizations doubled in a week. And joining us now with what we need to know, Dr. Richard Besser, former acting director of the CDC, the president of the Robert Wood Johnson Foundation. Hi, Dr. Besser. Good to see you in person. Hope we don't exchange any germs during this, but it's going around. It feels like everyone you know is sick with something. How do you explain this surge?
Yeah, I mean, I think there are a number of things going on. COVID isn't over as much as we all would love for it to be over. And then on top of that, every winter there are viruses. So RSV, something a lot of people had never heard of. It tends to come every winter. It tends to affect children pretty severely, but it can affect adults as well. You put that together with an early flu season, and we are in the midst of a strong early flu season. Those things together are putting a lot of pressure on everybody, but a lot of pressure on the healthcare system.
Now, did a lot of people get the flu vaccine this year? Because I've heard just anecdotally that people are not getting it this year for whatever reason.
Yeah, you know, it's something that's very concerning. I was talking to Director Walensky at the CDC yesterday about this, and the vaccination coverage rates for adults right now for this time of year are about half of what they were pre-pandemic this time of year. And I don't know if it's because people are just putting it off. No one wants to think about respiratory infections. Everyone's tired of getting shots because of COVID, but it's the wrong decision to make. It's an early flu season, and it may be more severe because we've had 2 years with very low flu. And it's been low because we've been away from each other. We've been wearing masks. We've been staying home. And normally each year our immune system gets a little tweak from seeing those. It's been 2 years, and so it is really strong.
Just real quick, the flu test. You know, I've heard it has, questionable accuracy. In other words, you might have the flu even if your flu test comes back negative. And what's the implication of that?
Yeah, you know, I wouldn't put too much on it. If you've got respiratory symptoms, you could have flu, you could have COVID, you could have RSV, you should stay away from people. You should wear masks. Coming into the holidays, coming into the season, get your vaccines, get your COVID booster, get your flu shots, because even if you're at low risk, chances are you're going to be around somebody who is at high risk, and you can do your part to keep them safe.
I know. You have something yucky. I had that all last week.
She had something but tested negative for the flu.
We used to call it the crud. Yeah. You know, you had something.
Right. That's right.
Just some. Dr. Besser, thank you so much.
Thank you very much.
Appreciate it.
Hey, thanks for watching. Don't miss the Today Show every weekday at 11 a.m. Eastern, 8 Pacific on our streaming channel, Today All Day. To watch, head to today.com/allday or click the link right here.